If you have ever had sudden heel pain that came out of nowhere that gives you pain with your first step after you wake up in the morning, it is actually not that uncommon. If your heel pain is not from a traumatic event, there's 2 or 3 possibilities that we can narrow it down to. The first is plantar fasciitis. However, this is considered more of a repetitive injury, which means your foot has probably been sore for a while now, and this is not something that happened overnight. Another possibility is an irritation of the heel fat pad. If your heel is tender to the touch, it could be inflamed, and it would be a good idea to ice the heel for a minute or 2. However, if your heel is not tender to the touch, it just hurts when you put weight on it. The simplest and most efficient way to resolve this type of heel pain is to provide a protective cushioning around your heel that will help to absorb the shock and the impact that comes with walking. If you only have pain around the heel, I recommend using a gel heel cup. There's 2 different types that you can use, and they are both very good. The first type looks like something you put in your shoe. The second type looks like a sock that you can put on your heel. Personally, I like the sock type heel cup a little bit better because it doesn't really matter what kind of shoes that you wear. You can wear it with a regular shoe or slippers, flip-flops, and you can even wear it without shoes. The only downside to using this type of gel heel cup is that it tends to roll off of your heel when you walk, unless you wear a regular sock over this gel heel cup. If you have pain that goes from your heel all the way to the middle of your foot, you could potentially have plantar fasciitis. You could test whether you have plantar fasciitis by stretching your big toe into extension. This will stretch the plantar fascia. So if you have pain with this stretch, then you probably have plantar fasciitis. In this case, the gel heel cup could still be very helpful. You can also try wearing a full shoe insert that is made of gel if you feel like the gel heel cup is not enough cushioning for you. The only downside of this full shoe insert is that you can only use it while wearing a shoe. It is not a bad idea to massage your heel with either plantar fasciitis or irritated fat pad type of heel pain. Massaging the tissues around the heel will help with increased circulation, and that will speed up the healing process. You could start by massaging the heel and then work your way down to the middle of the foot. If you do have plantar fasciitis, you can follow up the massaging with some gentle stretching of the plantar fascia. If you have the heel fat pad irritation version of the heel pain, it should go away on its own just by wearing the gel heel cup. So it is really quite an easy fix, except for the part that you will be limping around until you get appropriate cushioning for your heel. If your heel pain is caused by heel bone spur or heel spurs, we can treat it the same way we treat plantar fasciitis, through massaging the plantar fascia, stretching the plantar fascia, and cushioning the heel with a gel heel cup. If you feel that your heel pain still doesn't go away after massaging it and using the gel cushioning for a few days, you might want to get it checked out by a doctor and maybe get an x-ray just in case it's something serious. Now, if something traumatic had happened to your heel, such as falling down the stairs, banging your foot against something, or having a heavy object fall on your foot, you should definitely get that checked out by a doctor or go to an emergency room to get your foot x-rayed, because if you have a fracture in your heel, there's not much you can do about it except to put it in a cast. I hope this video is helpful for you. I went over the plantar fascia stretch in a little more detail in my previous video that I made for plantar fasciitis.